A lot of times when we see foot and ankle issues in our practice, one of the things we see is Achilles tendinosis. Some of you might hear it as Achilles tendinitis. Something we look for as well as a Haglund's deformity. Right on the back of your heel, you can actually see a bump. It's where the Achilles tendon attaches to the calcaneus or the back of the heel, and it's tugging on there over time. This happens for quite a while, and it causes a bony growth formation there. So on our patient model here, we would see that as like a raised bump right here, very common. It's this Achilles tendon here just pulling on that consistently, just real tight. And a lot of times when we check the ankle motion here, it's limited like it is here. And when we see that, we know that there's probably been some chronic tightness in this calf, the soleus part and the gastroc, all the way into the Achilles tendon. And then sometimes we see that it's such a big Haglund's deformity there, it's raised up, that the back of a shoe, an uncomfortable shoe, is rubbing against it. So we got to determine, is it just inflammation from a rubbing of the back of that bony growth formation, or is it true Achilles tendinosis, tendinitis that's happening, or is it an Achilles strain, which could be more of the actual tendon? So sometimes we're trying to differentiate between an insertional tendinosis, a Haglund's deformity that's just inflamed, has been rubbing against, or is it a strain of the actual Achilles? Worst case scenario, we have a pretty good tear or a rupture like you might have seen with professional athletes. That's rarely coming into our office. This is typically, we're seeing overuse injuries in our runners, our fitness folks, tennis players, pickleball, and we get into there. Typically we'll evaluate it once we've diagnosed it with that. Our goal through a lot of the muscle work we do, whether it's the active release technique or the Grasson technique, we're gonna get in there and really try to release that Achilles tendon all the way up into the calf to try to reduce some of that tugging that's happening there. Calm down the inflammation. Once we can calm down the inflammation, the pain would then go away, right? So that's a lot of times what we're seeing with this Haglund's deformity leading to a potential Achilles tendinosis. If it's an acute inflammation in this area, we want to do some things to calm that down. If this is a chronic issue, which is more of a tendinosis, we may need to actually get blood flow to the area, and that blood flow to the area will help the healing process, and some of the manual therapy that we're doing is going to address that. This same mechanism of injury, a lot of times we'll see with plantar fasciitis. There's some other things on there that we won't be able to discuss today, but a lot of times it's common. And one of the things we check is that ankle, what we would call dorsiflexion, bringing the toes to the shin. That's limited there. Is it limited to there? Then with our palpation and examination, we'll be able to determine exactly what's causing the heel pain that you're having on the back or all the way up into the calf. And so you may have a Haglund's deformity. It could be just a strain of the Achilles or the calf, or it could be something that's happening at the insertion of the Achilles.